Hi, I'm Dr. Robb, and I want to talk to you quickly about stretching. Now, after doing chiropractic care for 12 years and taking care of nearly 7,000 patients, and at one point in time when I had hair, long time ago, as a competitive bodybuilder, I learned quickly about biomechanics and lifting weights and exercising and stretching. And then I also know the number one reason that people are brought into my office is because they are bending over with the neck and they're bending over at the waist forward, known as flexion. And the reason that that causes injury is because when we bend over at the waist, when we look down with our neck, as a result of that, the bones begin to shift backwards. So when we put our body in flexion, the bones will shift backwards. Anatomically, what is behind the bones is when we see the spinal cord and these things called the peripheral nerves. So bending over, touching our toes and taking the chin and driving it into our chest is literally one of the worst things that you can do mechanically for your spine. Eventually, you're going to end up with a nerve that's being compressed as a result of a mechanical misalignment caused by putting your body in flexion. Again, bending forward with the head, looking down at a desk, or bending over, touching your toes. Two of the worst things you can put your back into. And I know that goes against the grain because most trainers, as I see in the gym that I go to, are always teaching people how to do that, rather than teaching extension, which goes back, which encourages a forward curve in that cervical spine, and of course going back and extension, doing sit-ups on a big therapy ball by supporting the lower back. You see, when we go back and extension, then what happens is these bones that are shifted backwards begin to go seated forward back into their normal position. Consequently, that's how I treat patients in my office as well, is I locate the vertebra that is shifted backwards, compromising the nervous system, and we set that bone back into place without twisting the patient. So that's a quick note about stretching. Avoid flexion and do more extension stretching. That's a quick minute with Dr. Robb. Thank you for joining me.